Good evening, everyone. We will be discussing the topic concepts of angiogenesis in oncology today. And we have with us Dr. Major Mirza Qaiser Baig. Sir is Associate Professor in Radiation Oncology in MLD Medical College, Jhansi. And Sir has a vast experience and has also authored several books like Principles and Practice of Chemotherapy, Practical Radiotherapy and Chemotherapy Planning, Concepts of Molecular Oncology. And we are privileged to have him with us. So, sir, over to you. And
okay, yes. Fine. Okay, fine. So, should we take off?
Yes, sir.
Okay. So, good evening, everyone. We'll be discussing regarding the concept of tumor angiogenesis. It's an integral part of oncology practice. We routinely leave or during the PG days these molecular oncology. Now slowly and slowly this molecular oncology is setting the new treatment policies in oncology. So we need to understand the bit about the molecular oncology. We have a 3-4 chapters will be into like tumor angiogenesis, apoptosis, cell signaling, and basic of molecular oncology and molecular oncology techniques. So we should, I'll be delivering a lecture in a series form, but since tumor angiogenesis I have chosen because of 2 reasons. One is it's a very burning topic, not because of oncology also. Now due to current pandemic, this angiogenesis is taking us too much of lives in the second wave of COVID. So I will go one by one. So this chapter is given in the concept of molecular oncology, which is being published by Walnut publication in 2018. We have also published a paper in the concept of angiogenesis from theoretical to bedside treatment in the field of oncology. Angiogenesis is basically the growth of new blood vessels, and which is a normal physiological and sometimes pathological disease process. We need to understand the mechanism by which this disease process starts. Somewhere it is very helpful, like in a healing fracture, somewhere in the cut wounds, but somewhere the angiogenesis is taking doing a problem, like in oncology, diabetic retinopathy, age-related macular degeneration, and atherosclerosis. So there are a vast number of it, so many diseases where these angiogenesis, but we will be focusing on the oncology subjects. Regarding the list of angiogenesis drugs which we are using, bevacizumab, thalidomide, lenalidomide, sorafenib, sunitinib, everolimus. Basically, angiogenesis is the formation of a new blood vessels. This process is a normal part of growth and healing. It is also play a role in several diseases. Cancer is one of them. A tumor needs nutrients and oxygen to grow by the help of angiogenesis. So you see here a normal small needles of a tumor. There lies, and then the chemical messenger is being released from the tumor itself, and then they keep on putting a pressure on the parent venule to form the new blood vessels. This I'll explain it in the subsequent slides. So the tumor keep on growing and growing because of neovascularization. The approval of several anti-angiogenic drugs for a systemic therapy for several malignancies has been developed. The bevacizumab is a humanized monoclonal antibody to vascular endothelial growth factor, VEGF. However, the success of bevacizumab in a combination chemotherapy in metastatic breast cancer and metastatic colorectal cancer is well established. And as a monotherapy, bevacizumab is used in the metastatic renal cancer. That is approved till date. So here we show you on the slide the tumor secretes vascular endothelial growth factor. the endothelial cells. This tumor, again the same slides, just elaborated. These vascular endothelial growth factor increases the blood vessels and expression and a movement of the tumor, movement to the tumor, new vessels, and tumor increase its blood supply and increase itself. So from where this concept is being developed, the first time this concept was developed by a Folksman, Dr. Folkman. He published a landmark article in 1997 in the New England Journal of Medicine, and the silent feature of his publication was a solid tumor will not grow beyond 2 millimeters in size unless they induce and sustain a new blood supply to provide the oxygen and nutrients from their growth of tumor. Why 2 millimeters is being taken up? Because up to 2 millimeter size, the tumor derives its oxygen nutrients by passive diffusion. So we need not, a tumor does not need any extra blood supply or any added neovascularization to up to 2 millimeter or less than 2 millimeter to sustain its life. So one should also, I'll also add here that's micrometastasis and a macrometastasis. So the 2 millimeter size is a cutoff line for when we say that it's a micrometastasis. It's a micrometastasis. I mean, if the tumor is up to 2 millimeter or less than 2 millimeter, and if the tumor is more than 2 millimeter, it is macrometastasis. So when the tumor cell population begins to produce tumor angiogenic factors, which creates mobilization of endothelial cells of pre-existing blood vessels. There are pre-existing venules, blood vessels near the tumor, from where these, after release of a tumor angiogenic factor from a tumor itself, these endothelial cells begin to migrate and divide and proliferate and form a tubular structure to form a new blood vessels. These blood vessels infiltrate in the tumor mass further to establish the new blood supply to progress of a tumor. So fourth point is the administration of anti-angiogenic agents, for example, anti-tumor angiogenic factor. Specifically neutralizing the antibodies will block the tumor angiogenesis process. But such tumor shrinkage would never be complete because of microscopic tumor, which size less than 2 millimeter or less than 2 millimeter or less than that will survive without new blood vessels because of phenomena. So this type of therapy cannot be called a curative. Like if you are giving a bevacizumab, that it's not curative, but certainly it will bring down the tumor mass up to the such level, less than 2 millimeter up to 2 millimeter, that where the autoimmune system can take care of the tumor. The Foxman further described in his report the nature of angiogenic switch present in the tumor itself. First stimulator of angiogenesis are basic fibroblast factor and several endogenous anti-angiogenesis inhibitors also. Certain angiogenetic drugs seems to have no clinical benefit when used as a monotherapy, but does have a good role when it is combined with the chemotherapy drugs. In addition to stimulator of angiogenesis process, there are number of endogenous anti-angiogenic factors having a down-regulatory effect on which lead to progress of tumor. Angiogenesis can also contribute in the growth of liquid tumors like hematological malignancies. So that's the anti-angiogenesis drugs is not helpful only in the solid tumors, it's also helpful in the hematological malignancies. This not only decrease the tumor cell mass or take care of a macrometastasis, but also inhibit the distant metastasis. I'll explain how it happens. The expression of number of growth factors like cytokinase by activated endothelial cells at newly formed blood vessel site as well as bone marrow. Even it is not a local phenomena, it is systemic because these endothelial cells give a signal to the bone marrow, which produce the endothelial progenitor cells released from the bone marrow, comes on the site of a tumor and then increase the tumor cell growth. There are no single tumor angiogenic factor, rather a large number of molecules involved in the angiogenic process. There are a number of sequential events involved. What are the steps in the new blood vessel formation? First step is breakage of endothelial cells basement membrane of a parent vessels, parent venule. After the breakage of these vessels, so who does this breakage? The breakage is being done by the matrix metalloproteinase and urokinase plasminogen activating factors. They actually they are termed as a pro-angiogenic factors. So first, the breaking of basement membrane that creates the movement of endothelial cells from parent venule towards the adjacent tumor, close to the adjacent tumor cells. And this process is stimulated by pro-angiogenic factors, which I told you, which are the, like you see here in this slides, the stimulus is by tumor, and then the tumor hit the parent venule, blood vessels, and this the second in the part of figure, you see the endothelial cells having a plasma membrane, and where is these receptors lies? Vascular endothelial growth factor receptors lies on these endothelial cells, and thus this leads to the phenomena of angiogenesis. The pro-angiogenic factors known as, I've already told you, the matrix metalloproteinase, urokinase plasminogen activator. You must be knowing about these enzymes. They are basically proteolysis enzyme used in the thromboligation of a myocardial infarction. The philosophy about two enzyme lead to a research to form a drugs which can inhibit the enzyme. So there are several steps in the angiogenesis. This is the first step. If we have a drug, till now we don't have that, we can stop this pro-angiogenic factors leading to the breakage of basement membrane, so they lead to the further angiogenesis. Second step is formation of new blood vessels and its migration of endothelial cells as well as division of mature endothelial cells adjacent to the tumor mass, and finally formation of new basement membrane of juvenile blood vessels. These new angiogenic blood vessels of tumor cells establish further growth of tumor cell population. Apart from this, some endothelial progenitor cells, I have told you, they formed in a bone marrow because of angiogenic factors, and they release from the bone marrow to the blood vessels, they reach to the tumor area and then keep adding on the tumor proliferation through the several methods. And also, these endothelial progenitor cells help in proliferation. So you are must be observing the endothelial cells is a key factor of closest to the tumor area, which is responsible for this angiogenesis. The progenitors reach to the tumor cell mass and stimulate division of mature epithelial cells, that I have already told. So there are several factors like fibroblastic growth factor, vascular endothelial growth factor, epidermal growth factor, angioprotein, which lead to the tumor mass proliferation. They are called as a directly acting angiogenic factors. There are the factors is being divided into two: direct acting angiogenic factor and indirect acting angiogenic factors. And there are certain endogenous anti-angiogenic factors. So I'll explain in the next slides. There is also one entity, it's very important in this sequence of angiogenesis. The pericytes is a single layer of peri-endothelial smooth muscles which modulate the endothelial cell function and critical for the development of mature vascular network. Since role of parasite is helping the survival of endothelial cells, thus parasites emerge as an important therapeutic target from angiogenic therapy. So I have told you the first is the stoppage of breakage of basement membrane, where the research are going on to develop such a molecule which can hit on that. Second is this parasite where we are working to form a drug which can hit this, and we have already in our hand working on the different steps. So molecular mediator of tumor angiogenesis, we have told you the directly acting, indirectly acting, directly acting growth factors are vascular endothelial growth factor family, including tyrosine kinase inhibitors, angiogenic protein, Notch signaling receptors, especially Notch4, have high degree of specificity for endothelial cell associated neurovascularization. And then these are the direct acting factors. What are the indirect acting factors? Tumor necrosis factor alpha, tumor necrosis factor beta, transforming growth factor alpha and transforming growth factor beta, inflammatory cytokinin IL-6, IL-8, granulocyte stimulating factor, platelet-derived growth factor, and some hormone estrogen and androgen. Among all, still the vascular endothelial growth factor was discovered in 1899 and replaced to be highly specific potent mitogen for vascular endothelial cells for its development and growth. So I'll little explain you why I've told you that most of the bevacizumab drug, anti-angiogenesis drugs, pathology and physiological phenomena which happens. Second, everybody knows that the COVID having a two-phase COVID-19 disease. The first is a viral phase. Second is the cytokine storm. So both we have two different drugs. What exactly happened in the COVID-19? It's a cellular level hypoxia. As you know, I have told you the hypoxia. I'll tell you also in subsequent slides. The hypoxia is a very very potent role in triggering the endothelial cells proliferation and release of interleukin, cytokinin, and tumor necrosis factors, which ultimately lead to the cytokinin storm. So, why the bevacizumab now is having a role, particularly in the pre-cytokinin or cytokinin storm phase, to avoid the ICU death in hospitals. So, this is the way, like it is linked to the COVID also. The original article research is being found in the extraordinary survival benefit of severe and critical patients with COVID-19 immune modulators, outcome of the clinical trial in Bangladesh, and second is a very very important trial, efficacy and tolerability of bevacizumab in patients with COVID-19. This is from the epicenter of COVID-19 from China. Again, there's the same this thing. The several factors release. You see in the figure, the nitric oxide also released from the endothelial cells. So nitric oxide is released from the endothelial cells, which we block by the bevacizumab. So the nitric oxide is a potent vasodilator. So the complication of bevacizumab becomes a hypertension also because it stops the release of nitric oxide. So there are several factors like 5-HT also help in the formation of tubular formation and angiogenesis. There are 4 roles of vascular endothelial growth factor by which it promotes the tumor angiogenesis. First, it stimulates the endothelial cells division. Second is induce endothelial cells migration from parent venue to the tumor site. Enhance endothelial cell survival, mobilize endothelial progenitor cells from bone marrow to the site of tumorigenesis, elevated expression of vascular endothelial growth factor commonly associated with the tumor hypoxia. So the hypoxia and the tumor overexpression of vascular endothelial growth factor thus lead to the vascularization of tumor mass. These are subsequently happens. So endogenous, there are now I have told you much about the factors which promote angiogenesis. There are but as a in form of autoregulation in the body, there are endogenous inhibitors of a tumor angiogenesis also. In addition to multiple factors, anti-angiogenesis factors are first inhibitor is a large glycoprotein molecule present in the extracellular matrix named thrombospondin 1, which is being regulated by p53 gene and found to regulate thrombospondin. Loss of p53 gene associated with the downregulation of thrombospondin 1. So if it is loss of p53 genes, then downregulation of thrombospondin 1, that means upregulation of vascular endothelial growth factor that lead to angiogenesis. The second inhibitor is vasoinhibin, a protein which is secreted by endothelial cells and a stimulation of angiogenic factors, vascular endothelial growth factor. The biology of endogenous angiogenesis inhibitors is that they may be induced by other cancer therapy to have added effect. For example, some anti-angiogenic treatment strategy, such as low-dose metronomic chemotherapy or a doxycycline, are potent factor to induce elevated level of thrombospondin 1. So metronomic chemotherapy, you all be aware, the given in form of a maintenance therapy, 1/10 of a normal dose, given on the continuous basis, and a doxycycline. So doxycycline does have a role in the COVID also. The reason is simple. It is a induced thrombospondin 1, so it inhibits the angiogenesis, which is happening in the COVID-19 later stages as a form of, as a subsequence of cytokinic storm. So let us have a little bit deviation from our main topic. Like I have made a COVID-19 patient important medicine kits, and these medicine kits can be used on the routine basis for ambulatory patients. So you must see the every doctor is writing on this prescription slip the doxycycline. So anybody can ask you what is the role of doxycycline. So doxycycline is never being used to prevent the secondary infection in a COVID patient. Is because of this, the doxycycline role for it is known to induce the level of thrombospondin 1, which directly inhibit vascular endothelial growth factor, which inhibit the angiogenesis. The strategies for development of anti-angiogenesis drugs, the most obvious strategy would be development of drugs that neutralize the pro-angiogenic growth factors such as vascular endothelial growth factor. All approved anti-angiogenic drugs either block the vascular endothelial growth factor or vascular endothelial growth factor tyrosine kinase receptor. Example like bevacizumab drug developed to neutralize vascular endothelial growth factor. So here in picture you see tumor cell, hypoxic cell, blood cells. So as much as the hypoxia is there, you see that as much as the new vascularization is there. So hypoxia itself is a triggering factor for neovascularization in the tumor. In addition to the antibody or protein therapy, a large number of small molecular receptor tyrosine kinase inhibitors have been developed to block vascular endothelial receptor phosphorylation, such as sunitinib, sorafenib. These drug action, like sorafenib, used in metastatic renal cell or hepatocellular carcinoma. These drugs also does anti-angiogenesis, but also does have a role, direct anti-tumor role. So they killing the tumor cells itself as well as they disturb its blood supply in form of anti-angiogenesis. So the way they work. Bevacizumab, when used alone, not effective, but sometimes along with the chemotherapy drugs, which have a good role, like other drugs like cetuximab or trastuzumab do have a down-regulatory effect on vascular endothelial growth factor and up-regulatory effect of thrombospondin 1. So, how anti-angiogenesis drugs enhance the effect of radiation and as well as chemotherapy? So here you understand the anti-angiogenic drugs is hitting on the new blood vessels, and by hitting the formation of new blood vessels, it from I have told you the endothelial cells which responsible for a new blood vessels is coming from already intact blood vessels in a tumor. So breaking of a basement membrane, mobilization of endothelial cells from parent venule, it is being also stopped. So the leakage of a parent intact blood vessels and maintenance of healthy parent venule is being done by indirectly by anti-angiogenic drugs. So what happened? The tumor oxygenation and a blood supply increases in the tumor area. So the chemotherapy adequate dose reaches to the tumor area as well as the radiotherapy due to increased oxygen also increases effects. That is the reason. So markers of angiogenesis, the possible markers in the blood, you see the cytokinin, interleukin 6, interleukin 8, and several blood proteins, and pro-angiogenic growth factors circulatory endothelial proteins. But actually, the diagnosis for if you starting bevacizumab, what should we do? We should take a biopsy done, and a biopsy will of biopsy and further subsequent to immunohistochemistry. And that is not from the site of a tumor. It should not from the site of a metastatic site. You have to take the primary tumor site and now assess these vascular endothelial growth factor. Now, if overexpression, that indicates that the patient will be benefited by bevacizumab. So the required tissue specimen for immunohistochemistry study, but the tissue specimen must be from the primary tumor site, not from the metastatic site. So that is the only test which we have available now, or a fish you can go. What are the benefit of anti-vascular endothelial growth factor therapy? It inhibits the new vessels in the tumor, blockage of development of endothelial progenitor cells from bone marrow, normalization of vasculature of pre-intact blood vessels, thus decrease the permeability of blood vessels and increase the chemotherapy drug delivered to the tumor tissue, and that indirectly also oxygen. So the chemotherapy and radiotherapy also help. Added effect. The direct effect on the tumor as an anti-tumor effect, inhibition of a damage to the endothelial cells by chemotherapy drug, and have to have immunomodulatory effects. Like if we combine the bevacizumab with the paclitaxel-based chemotherapy, we have a good outcome in the breast cancer, it is known, and in the colorectal cancer, we use bevacizumab is we can have enhanced and good results. So, last not the least, what is the toxicity we face for is the hypertension is a most known. I've told you why, because from endothelial cells, the nitric oxide release, which is being stopped usually by vascular endothelial growth factors. So that's due to the hypertension. Proteinuria is another complication, bowel perforation, and deep thrombotic events. So these are the complications of vascular endothelial growth factor therapy. Good luck and thank you for your kind attention. Hope I was audible.
Yes, sir. Thank you so much, sir. It was a really nice presentation and very well covered this important topic, and one topic which is not well understood in a very simple language. So thank you so much, sir. And there are also a few questions in the chat box. Sir, like how is bevacizumab useful in COVID?
Okay. Like I've told you, what happened.
Motion management technique is recommended. Answer to that is yes.
How it is helpful. We are still in the trial phase. We are still in the trial phase for bevacizumab, but theoretically it leads to very uh, strong support, because what does the bevacizumab? Bevacizumab is basically, we know, the potent blocker of vascular endothelial growth factors. And what does the vascular endothelial growth factors does? They release the interleukin, cytokinin, tumor necrosis factor. So, and thus bevacizumab does what? It also inhibiting these things. So the concept of bevacizumab is introduced in the COVID because of this factor. Because we don't have too much drug against the angiogenesis, because for angiogenesis in a retinopathy, diabetic induced retinopathy, the ophthalmologist use the bevacizumab. Yesterday, I have discussed with one of my colleagues. She told that she used bevacizumab for that. So, since this drug is too much trial is going on in India and abroad as well, we'll have a comprehensive policy regarding. But theoretically, it appears to be having a very strong evidence that it should be used. But we don't have a meta-analysis or phase 3 trial regarding the bevacizumab for COVID-19. I think.
Thank you, sir. And, sir, sir, you said bevacizumab works when it does not work so good as a monotherapy, but works better if used as with another chemotherapy.
Yeah, exactly.
So, sir, like, is there any specific reason for that?
The specific reason is simple. Like if you saw, its answer lies in the radiobiology. Sometimes, if you decrease the tumor mass, the tumor burden, certainly the other drug is more effectively working. It's also a tumor size. So what happened with the bevacizumab, if you're using the paclitaxel in the breast cancer, what does it has a bimodal action. Like one is directly killing the tumor cell heavily, and another is interrupting with supply. So we have added effects. But if you see only if you are giving a bevacizumab, so that what you are doing basically, you are just stopping the further spread, further metastasis and further angiogenesis. But what happened to the large tumor mass, which is already there, which cannot be controlled by the only single agent bevacizumab.
Okay, sir. Sir, you said that when taking a biopsy for the measuring VEGF, it should be taken from the primary and not from the metastatic.
Exactly. That
so,
I don't know exactly. Honestly speaking, I don't know the answer of this, and I have found in anywhere why data, they have stressed that if you want to go for a biopsy for immunohistochemistry, you take the tissue from the primary side, not from the metastatic side. They have not explained, and so that I am not being explained. So I'm sorry for that. Keep scratching your mind to kill that.
Okay. Okay, sir. So are there any other questions? Okay. So, sir, it was really a wonderful class, and you covered all the aspects very nicely and in a very simplified manner, such a complex topic. So thank you so much, sir. Thank you once again for spending your precious time to educate us all. And we look forward to your next session, sir. Thank you. Thank you so much.
Oh, okay. My pleasure. My pleasure. I'll be taking the next class in the concepts of molecular oncology and other chapters. So in the 3-4 chapters, we'll wipe up the molecular oncology, which appears to be very something like is off-going, off the beat topic, but it does have an impact on the conceptualizing the treatment policy in the modern medicine. Thank you. Good evening, everybody.
Yes, thank you, sir. Thank you, everyone.
Oh.